First on the agenda, QFOR, a leading provider of healthcare exchange platforms and IT services with proprietary social media, mobile analytics, and cloud technologies. SMAC technologies are projected to be worth $5 trillion by 2020, and QFOR has already developed over 20 platforms to address this market. Now, let's go to the interview with Chairman Dhru Desai. Dhru, thanks for being with us again today.
Glad to be here, Dave.
Great to have you back. QFOR, you've been executing very, very well. You recently announced a significant deal in Arkansas with one of the biggest Blue Cross Blue Shield agency there. You're helping to build out a healthcare exchange. So I want to start there and talk to us about that contract.
Yeah, we are very fortunate to have that kind of endorsement coming out, and quite frankly, the validation of our technology. Greg Hatcher, who is the founder president of the Hatcher Agency, as you said, they are the largest producer in the Blue Cross system in the state of Arkansas. I think when they understood what we're doing with our product technology and how the other health plans, including the Blue Cross across the country, are looking at various things, it was a no-brainer decision for them to choose us, primarily for two reasons. One, our technology can help them enroll multiple products, the whole portfolio, if you will. And we have the complete financial back office products for the invoicing and the billing and so forth. Quite a few agencies do not want to get into that and build that capability. So if it comes as a part of the exchange, that is a big plus.
Right. Give us a little flavor of the landscape now for healthcare exchanges. You're building non-public or non-government exchanges. There were some problems early on with the government exchanges. I think most of those glitches have been worked out. How many people will go into the healthcare exchanges system over the next 2 to 3 years? I've seen some estimates.
I think most surveys suggest that there are about 100 million Americans will buy health exchanges and various insurance products in an open market, in a private exchange fashion over the next 4-year period window. I mean, the horizon window is starting 2014 through 2018. We're going by that number. About 100 million is an addressable market.
Now, I've seen 80 million. In fact, here Bain Capital, you can see up on the screen here a quote from an analyst that covers this space, and I think he's estimating about 80 million, yeah. So some a little higher. Where do you fit into this?
Where do we fit into that? Our product covers the entire spectrum. We can do individual exchanges, we can do group exchanges, and we can do not just the health products, but supplemental dental, vision, and non-health related benefits also. So that gives us a wide spectrum. We can cover the entire addressable market with single product platform offering. As we stand today, middle of February, our sales pipeline is pretty close to about 18, 19 million lives that we are engaged in discussions with various, and these opportunities represent some of the very, very large key health plans, insurance companies directly.
And how do you make money? They enroll on the exchange?
They enroll in exchange, and we get some setup fees and initial licensing fees, and then we get residual anywhere between $2 to $5, $6 a month on various features for the enrollment and management services.
So even 1 million lives at $2 a month is another 24
2 million a month. Yes, 24 million.
24 million in revenue, and you're already doing 40 million on your existing sort of IT consulting infrastructure business, and you've also recently cleaned up your balance sheets. That's one of the criticisms that if one's looking at your balance sheet, that's the one thing they see about your company that they sometimes have a question mark on. So talk to us about how you've cleaned it up.
Yeah, first of all, we had about $18, $19 million of the total debt. Total debt includes our current debt, which is secured against receivable, and some of the long-term debt we acquired through the acquisition process. $4 million EBITDA is a lot of cash flow for us that very comfortably services the debt and reduces the principal on a scheduled manner. What we have done, though, very aggressively in last 2 quarters, we have taken down pretty close to about $7-8 million worth of debt out of the book. We have converted in some cases into equity. which is priced at much higher prices than today's price, and substantial lock period alongside with it. Some of the earn-out payments and so forth we have discounted and paid down with our warrant conversion money that has come in. So we have essentially roughly halved our debt load.
So you're not having a problem servicing your debt?
None whatsoever.
That's the bottom line. I think that's important for our viewers to understand. Now, we have a $7 target, 12-month target on your stock. And so when we look at price to sales multiples, when we look at price to EBITDA multiples and cash flow multiples, your stock's very undervalued. And you see, I'm holding the bull today. And if I'm holding the bull, I'm very bullish. This is the RedChip bull. It's quite heavy, by the way, made of marble. Why don't you pat it for me, and you can see.
Go Bulls.
You can see that it's quite bullish. Now, so I am very bullish on your company, sincerely, because if 19 million lives in the pipeline, I'll take 1 million or two, because that's going to double your revenues at 2 million lives.
Sure.
What is the essential value proposition for investors today?
Essential value prop is our core business, which is in the SMAC area.
Social mobile
analytics cloud, extremely deep technology set. We're growing organic 20% in that sector. Now we are getting into some of the larger size deals that are also percolating. We didn't talk about that. We talked about the health exchange deals, but that business is steady and growing. We're bringing all of those technologies into our health exchange technologies, which is the biggest disruption epicenter right now. And we believe our platform allows both the consumers as well as the providers of the health insurances and so forth evolve from here on out, embrace new business models, and we are very well positioned to execute that plan. We got 600-700 engineers working day and night very hard, and we're just fortunate to be in this space at this given time.
You are, and you're executing extremely well. Dhru, thanks for being with us today. We'll
Appreciate
be back.
it. Thank you so much.
Get you back in here soon. My value proposition for Q4. We are targeting $128 million in revenue in 2015 for this company. We're projecting $35.1 million in EBITDA. We derive a price target at $7 based on these projections. Stock today, as of the recording of this interview, is 75 cents. If the company hits only 50% of its revenue and EBITDA targets that we're projecting, then by our valuation, the stock still trades in the $3 range. This is a buy. It's a strong, strong buy. Now, Quadrant 4 is a RedChip client company. We do receive a monthly cash fee and 750,000 shares of Rule 144 stock for 6 months of investor relations services. That was for the first 6 months. We signed that contract when the stock was 6 cents. Second 6 months, we haven't negotiated. I'll let you know what it comes out to be, but it's not going to be nearly that many shares. Now, to get a complete list of all the stocks in the RedChip Nation, sign up for the RedChip Small Stocks Big Money Weekly Report. It's free. You'll discover some of the best names in small cap stocks, complete with reports, news, small cap lessons, blogs, and analysis, all on the smaller cap sector. Sign up for the RedChip Plus Investor Package. It's only $9.99 a month, money back guaranteed, and you'll get my book, Microcap Superstars, interviews with the biggest names in smaller cap stocks. Learn the secrets of the pros. You'll also get all of our research profiles and reports 24 hours before the general public. You have early access to each episode of the RedChip Money Report before it airs on Fox Business and Bloomberg. And access to all RedChip virtual conferences. The right to speak with our specialists Monday through Friday, 8 p.m. Eastern. Ask them any question about any stock in the nation. Give us a call right now, 1-800-RedChip, or visit redchip.com for RedChip Plus.